Welcome to Energy Insights, your trusted space for clear, evidence based conversations on the future of energy. I'm your host, Stephen, and today we're tackling one of the most persistent myths in the energy world, which is wind and solar projects are a threat to public health and community well being. From news headlines warning about wind turbine syndrome to fears that solar farms ruin rural landscapes, these concerns pop up time and again, especially when new renewable projects are first proposed. But what does the science actually say? And why do these fears still gain traction, even when the data tells a different story? In this episode, we'll explore the real world impacts of wind and solar power on public health. We'll talk about the noise levels, the materials, the myths, and most importantly, the measurable benefits renewable energies are already bringing to people's health, local economies, and national budgets. So let's get into it. Let's start with the myth. Some of the loudest opposition to wind and solar projects has nothing to do with energy systems or carbon emissions. It comes from the people worried about how these projects might affect their lives, their families, or their communities. Their claims range from anxiety, insomnia, and headaches near wind farms to speculation that solar panels could contaminate the soil or leak toxic materials. These ideas often surface during the planning phase of projects, long before any turbine is installed or any panel is activated. And while they sound serious, they don't hold up when you look at the evidence. Multiple large scale studies have reviewed the supposed link between wind turbines and health issues, and the results are consistent. No causal relationship has been found between proximity to wind turbines and illness. Study from the Massachusetts Department of Public Health and the Iowa Environmental Council show that modern wind turbines placed about 500 meters away are quieter than most city environments. We're talking about 38 decibels at that distance. That's quieter than a typical air conditioner. What's even more telling is that in many cases, the discomfort people report is linked more to perception and expectation than to the turbines themselves. In other words, misinformation can strongly influence how people feel. In short, people may be experiencing stress not from a turbine itself, but from the what they have heard about it. Now let's shift from fear to facts. Wind turbines and solar panels are built to global safety standards. Wind energy doesn't emit pollutants, doesn't burn fuel, and doesn't degrade air quality. Modern solar panels are mostly made of glass and aluminum. They are sealed to prevent any leakage and don't produce fumes, gases, or particulate matter. Once installed, they just sit there, quietly turning sunlight into electricity. This is where the public health benefits start to shine through. Because the real danger to community isn't a wind turbine or a solar panel. It's the fossil fuels that renewables replace. Burning coal, oil, and gas releases sulfur dioxide, nitrogen oxides, and fine particles that can penetrate deep into our lungs. These pollutants are linked into millions of premature deaths worldwide every year. They make asthma worse, damage the heart, and drive up healthcare costs. And they don't just hang around power plants. They spread across cities, towns, and rural areas, making the air unhealthy for everyone. But every new megawatt of solar or wind energy that comes online pushes fossil fuels off the grid. That means cleaner air, fewer hospital visits, and less pressure on national systems. Now let's talk about money. When you improve public health, you reduce public spending. The data shows that investments in wind and solar lead to lower rates or respiratory illness, fewer work days lost to sickness, and less need for expensive treatments. That translates into real savings, not just for governments, but for families and businesses. The report from Zero Carbon Analytics puts it clearly. Every dollar spent on renewables prevents several dollars in future medical costs and disaster recovery. Think about that. We're not just talking about saving lives, but also preserving budgets. All right, it's time to reframe how we think about energy subsidies. If governments keep subsidizing fossil fuels, the very sources that cause chronic illness and pollution, they're basically using public money to make people sick. On the other hand, every investment in wind and solar is a proactive step toward national health security. But the story doesn't end with health. Wind and solar projects bring new life into local economies. They create jobs in constructions, operation, and maintenance. They offer lease payments to landowners, injecting income into rural areas. And they increase municipal revenue through taxes, which can be reinvested in schools, roads, and public services. Studies also show that property values tend to recover and even rise within 5 years of wind farm constructions. Especially when projects are owned by communities, the benefits multiply. Share ownership means shared profits, which strengthens social acceptance and builds local pride. Transparency and trust are key here. When communities are brought into the planning process early, when the benefits are explained clearly, and when people see that they are not being left out, opposition fades. Fear gives way to participation. And in countries with mature renewable industries, health complaints have all but disappeared. What's left is a sense of ownership, a feeling of contributing to a cleaner, more resilient national energy system. Lose sight of the real danger. It's not wind turbines. It's not solar panels. It's fossil fuels. Fossil fuels continue to burden public health systems. They degrade the air we breathe, damage the land we live on, and accelerate climate change. Every day we delay the transition to renewable, we pay for it in lives, in hospital bills, and in economic losses. Energy policy is health policy. The choices we make about how we generate power shape our lives, not just for the climate, but for our day-to-day well-being. If policymakers truly want to protect citizens, renewables must become a core part of public health strategy. So where does that leave us? Wind and solar are not just clean, they are safe, they are economically sound, and they strengthen the communities they serve. It's time to leave the myths behind. The evidence is clear. Wind and solar improve health outcomes, reduce economic risks, and provide long-term stability for nations and neighborhoods alike. For governments looking to balance growth with well-being, the path is right in front of us. Investing in renewables isn't just smart energy policy. It's a smart public policy. Thank you for tuning in today's episode. If you found this episode insightful, don't forget to like, share, and subscribe to stay updated on the latest in the energy transition. For more in-depth analysis and updates, visit our website at energytracker.asia. Thank you for tuning in, and I'll see you next time on Energy Insights.